Good afternoon. My name is Kevin James. I'm the Expert by Experience Chair for the Equally Well Expert by Experience Working Group. So yes, I'd like to speak about my experiences as the Equally Well Expert by Experience Chair about receiving the COVID jab. And for the most part, it was a very positive experience, a few challenges, but it was a really good experience for the most part. I booked online. As booking my first COVID jab, I was asked to make sure that I booked my second as well. I ensured that I left for the appointment within plenty of time. It was somewhere where I wasn't familiar. I didn't know if there was a car park there. As a disabled driver, I need to make sure that the parking was close to the venue. And of course, it may be a pay and display car park as well if it's at a hospital. So just be mindful of that. When I got there, there was some queuing. So just be mindful if you are disabled. If you do have a complex comorbid condition, you need to sit down, maybe take a fold-up chair with you or a walking stick, something of that nature. I did have to fill out a 2-page A4 size form, just asking things about whether I've got any allergies and a little bit of medical history. Just be mindful if you struggle, if you're dyslexic, something of that nature, that you got some support with that. Reach out, ask a nurse. I did once I got in there. I had ticked a couple of wrong boxes, but the nurses helped me fill out the form again, and it was really good. So the survey was good. The process was pain-free. I had the injection. It was a very small needle. There wasn't any pain to it. For about 24 hours afterwards, I'm right-handed, so I had the jab in my left arm. It was, a little bit painful for about 24 hours. I was asked not to lift anything heavy. I felt a bit tired for a couple of days afterwards, a little bit lethargic. That's really nothing to worry about. It's quite a common thing to experience in respect of the jab. Some advice that I would give for people with severe mental illness or complex comorbid conditions is really do your homework, prepare. So Google the address that you're being invited to. Make sure that there's parking close to the venue. Make sure that if it's pay and display, you take some cash with you. When you book your appointment, there may be some questions that you might want to ask the people over the phone about what you need to do beforehand, and just prepare really. Check if you have any special reactions or allergies before having the jab, so you can talk to that via your GP. Just make sure. Dress accordingly. So when I had my jab, it was quite cold. So dress up warm. You may have to queue for a little while. Take your own pen with you if you can. Take some sanitizer just so you're not sharing pens with other people. If you do have a disability, if standing up is difficult, if you've got a complex comorbid condition, just make sure if you can, every opportunity, take a carer with you or a personal assistant, something of that nature. Just make sure that it's especially that it might be a very busy environment. So just be mindful of that if you struggle in busy environments. Afterwards, once I had my vaccination done, I was shown to a very quiet area. I was asked if I'd like a cup of tea or coffee or some water, and I just sat there for 20 minutes. Just to make sure that I hadn't had any adverse reactions, not that anybody would. And once that 20 minutes had passed, I got up and I was able to leave and I came home. And that was my experience.